Now, that's enough about our showcase, and I'll talk a bit more about it in a minute, but what I wanted to do was to provide an opportunity to Dr. John Skinner, who's the Acting Research Director of Poche Sydney, to tell us a bit about what's happening in research through Poche, the Poche Centre here at the University of Sydney in 2021. John, over to you.
Thanks, Tom. Thanks for that welcome. And thanks for the feedback from people about not being able to see us. So that's why I've moved up the front, and someone helpfully texted me that if I moved up the front, I'd be closer to the food as well, which is very good feedback to have. Sorry, I'm just getting myself organised here. Sorry, let's get through to my slides. Here we go. Right, so thank you, everyone, and thanks for that introduction, Tom. I just want to give a bit of an overview of where we're up to with some of our research at the Poche Centre at the University of Sydney, and just how that fits into our wider strategy moving forward as well. I'd like to just add to the previous acknowledgements. I'd like to acknowledge that we're physically here today for the first time in a long time, meeting on the lands of the Aboriginal people of the Eora Nation. I think it's about the first time in 4 months that many of us, well, I've been in the office here at the University of Sydney. So I'd like to pay my respects to elders past, present and emerging. I'd also like to pay my respects to all Aboriginal and Torres Strait Islander people joining us online, and also, as Tom mentioned, any other First Nations peoples from overseas that might be with us as well. This year we've been doing quite a bit of strategic planning, and to plan for the future, you also look back and look at what you've done. And we started thinking a little bit about what's distinctive about what we do at the University of Sydney Poche Centre, and looking back on our research, some of the key distinctives are that it's very much grounded in community connections and the needs of community. We've always wanted to have policy relevant research that leads to change in policy and practice. And then we've also always had a strong focus on workforce as well, and seeing those wider links to the social and emotional determinants of health, and how work and employment is a key factor in that. We also saw that it was important to deliver evidence-based services in areas of need. So where there were gaps in services, we also found it was important not just have research alone, but also to address real needs in communities, but also to look at how we evaluate and come up with community-based models of healthcare. So they're just a few of the distinctives when we look back at what we've done and how we wanted to move forward with our new strategy. Tom mentioned this is a meeting of our network, and I actually would like to acknowledge this slide I've adapted from the Poche SANT prospectus. So the link is there to Flinders Poche. And I really like this slide that they've come up with about those intersecting circles, that our research links with a range of resources from government, from donors, NGOs. And I've added in that NGO and community, because for us, a lot of our resources come from outside of government and outside the university. And over on the research side, I've added in community there as well, because a lot of times our communities are our research partners, and they actively become involved in our work, and we want to develop up that community research pathway and resources locally. So that's, I guess, what I've sort of coined here is really, this is really a Poche model of community engaged and translational research that many of our Poche centres across the country are involved in one way or another. And so that's what is another, I guess, key distinctive, that we don't just stay in one circle, but we intersect across these different circles. In terms of the focus of our research at the University of Sydney, we've always been very interested in co-design and solving real world problems with Aboriginal communities. We've always wanted to support and promote Aboriginal researchers and also advocate and embed Indigenous research methodologies.
So
I guess
if you're talking about the data governance review,
going forward is we really want.
Yeah, so it was more of an internal review rather than an audit.
Health
so we didn't deal with it as an audit per se. So it didn't make up part of our formal audit plan. It was done by me, is the short of it.
I'm just getting a bit of feedback here.
Yeah,
I don't know where from. We're just sorting that out. Don't know what's going on there. Getting some competition. Yeah, sorry about that. And we're also very much looking to get more external funding from Category 1 grants for our research as well, and how do we participate more broadly in that with our collaborators and partners. So in terms of the key research projects that we have, I've limited to those that we have existing ethics approvals for at the moment. We've got a number of others that Bo mentioned that are developing as well, such as the water project, but we've always had a strong interest in oral health, workforce. Bo mentioned precision medicine, the work around Be Well and cardiopulmonary health, ear health, and we'll hear a bit about that later on. We'll hear from a number of these collaborators over the next few days around breast cancer. We'll also hear about that as well. So a number of these projects we hear about over the next couple of days. So in all these projects, there's community connection, there's strong collaboration with partners, both inside the University of Sydney, as well as with other universities, government, professional associations, etc. And so really that's what is the strength of the model, as well as that collaborative nature of the model. I really want to highlight that Bo and Tom are critical to our research engagement. Clearly there's limits to what I can do as a non-Aboriginal person, so I'm an ally in that work, but Tom and Bo are critical to that work. And I also want to acknowledge that we're supported by a small research team, affiliates and partners inside and outside the university. And I went through the programs, at least 10 of our affiliates and partners presenting over the next 2 days, which I think is fantastic. I won't go through all this slide in detail, but just to show that we have quite a bit of engagement both within the university, but also outside the university. We did a lot of work with government, professional associations, and the Aboriginal community controlled sector. And like today, we assist with hosting of workshops and forums. And I think the last point's really important as well, that Bo and Tom in particular play an important role in assisting others with the governance of research, policy and practice. And so we contribute to that important area around governance as well. So I've tried to this is a really busy slide, so I won't go through every point in detail, but I just wanted to show some of the key numbers of what we're doing here. Although we're a small centre, we supervise and support up to 12 postgraduates annually. Majority of those are within the Faculty of Medicine and Health. In 2020, we published 27 research articles in the peer-reviewed literature, and we'll probably have a similar number in 2021. And we're CIs and AIs on multiple grants, including ARC and I mentioned that research governance component as well. And I guess that last point is really important too. We collaborate with at least 20 external partners in research engagement and impact. And I think that's, for me, one of the power of the Poche centres is that we bring those partners to help us address Aboriginal and Torres Strait Islander health concerns and challenges that we can't do it on our own with the resources that we have by ourselves. I also just wanted to spend the second half of the presentation just quickly reflecting on our new strategy. that we've been developing over the last couple of years. It's a new 5-year strategy. So what I've got here is just our vision, I guess, and that is around partnering to deliver practical, innovative solutions to complex problems facing Aboriginal and Torres Strait Islander communities. And the title of, or our key aim is to build strong and healthy communities. I also wanted to acknowledge the great artwork by Amanda Allen, and she's a proud Bundjalung artist, and she painted this or created this amazing piece of art which represents our historical past with strong spiritual connections to great possibilities. And I really love that it does reflect where we want to head as the Poche Centre. That we've had this strong foundation, but we want to reach into the future and look at those great possibilities for the future. And as Tom mentioned, a future where youth take a key role as well. So the 5 key areas of our new 5-year strategy is community engagement, research and evidence, service delivery, workforce and training, influencing policy and practice. And as you can see, we've got the beautiful artwork takes pride and place on the front cover of the document. In terms of community engagement, I've spoken about earlier in the presentation about those relationships with Aboriginal community, the importance of that ethical research with collaborations with the AHMRC as well, and making sure we identify the research needs and the community health needs of communities that we work with. We'll continue to broker relationships between Aboriginal communities and University of Sydney staff, and that's a key role that Bo plays. And we'll continue with Tom's leadership to collaborate with government and various organisations, at local, state and federal levels. In terms of our research, clearly embedding Aboriginal research methodologies is critical to our work, and that's something that we've been developing over the last few years, is to place greater value on that and to develop that further, and then also develop new partnerships inside and outside the university as well to try and maximise the impact of our research. I've mentioned about ethical research, so I won't go into that, but we'll make sure we keep those strong links to the guidelines of NHMRC and the Aboriginal Health and Medical Research Council as well. We really want to grow our research outputs, so we have greater recognition as a centre of excellence in that area, and bringing together that research and evidence findings at Australian and international conferences. And we still want to keep that link to service delivery where we can, to embed research into development of effective models of care. And critical to our work is increasing our number of particularly Indigenous HDR scholars. That's one of our key goals for the future. In terms of service delivery, I'm not going to go through each of these points in detail, because you can see them there on the screen. But what
we're getting somewhere now. I've got service delivery. I've got big thing. You are viewing the Bo Rambini's, right?
That's exactly where we should be.
Okay, that's excellent. Well done so far. Now I just want to check that I can bring up.
We're just getting a bit more feedback again. I don't know where from, but I'll just continue on in any case.
Just one. My power.
Sorry about that. We're just getting some feedback. We're not sure where
How's
from.
that? Okay.
Hello.
Hello.
Yeah, you're coming through on the speaker. That's impacting on the presentations.
Share screen right now because somebody else is sharing the screen.
Okay.
Don't put a mute.
So what will happen when it's your time, in between now and when you're presenting, if I will be messaging you to say you're coming up soon.
Yes.
And you'll see that there is a green share screen bottom at the bottom of your.
No, I just told him. But
and when you're ready, you'll hit that.
No, we can't do anything here.
Okay.
Just ask Steve what to do.
Can everyone who's online mute themselves?
Okay, that's good. we've got this sorted out. So I'll just wait here patiently until you give me the nod. And,
yeah. Don, can you hear us? Can you mute?
Yes, I can. Just a moment. I'll turn off the my mobile, so I'll see you later, and I'll just do the Zoom. Yes. Hey, Bo, I can hear you there.
Okay, John's doing a presentation at the moment. When it's your turn, Tom will bring you in.
Thank you very much.
Thank you. Bye.
He's got to mute his
system. You've got to mute your system, mate. So we.
Okay.
You don't mind? Thank you.
Sorry about that. I apologise for that break in transmission there. Yeah, sorry, just put me off my flow there a little bit. Yeah, so just around service delivery, clearly we'll maintain some of those connections with workforce. We're looking at a project with the Sydney Dental School at the moment around some our dental assistants scholarship program and how we might be able to adapt that to create entry pathways and scholarships into the Bachelor of Oral Health. We're also looking at some of those links to the Indigenous research network and how we can make sure that co-design community relevant research is embedded into that from New South Wales, and that would include some work around models of care as well that we're developing with some of our partners. We're also looking at continuing with our student placements. That's always been a key part of our work. And we're also we're working on some work with the University of Melbourne around cultural competency, and I think there'll be a presentation about that later in the program as well. I'll just move us through because we're starting to run a bit short. In terms of workforce, we want to continue to embed some of our workforce programs into our research grants. So we're always looking to create links in our research grants with workforce research and improved models of prevention and care. And we see that nearly all of our key research projects like ear health, precision medicine, allied health, they all have workforce links, and nearly all of them have vocational educational training links as well. So we've been doing a lot of work with TAFE, but also the Indigenous Allied Health Association around some of these pathways. I've spoken a lot about influencing policy and practice, so I won't go into that in detail now, but that's part of the work that will continue into the future. In terms of KPIs, we're trying to set up some new KPIs for the future, so we have something that we're aiming at and look at achieving around our research. And so we're looking at generating new research projects, keeping up that publication rate, improving our citation rate, but also growing future research leaders is a critical one. And I guess that's what I'd like to say is one of our key focuses is training future research leaders and creating pathways for masters and PhD students then to flow into a research career and creating those research pathways. So finally, I'd like just a sincere thanks to all our affiliates, students, staff and partners. Without you, our work would be substantially less impactful than it is. And so we sincerely thank everyone, and you'll hear from a lot of our partners over the next couple of days. So thank you. So, Chair.
Well, thank you, John, for sharing, the very depth of high quality work that Poche Centre in Sydney is undertaking across New South Wales, but also, as we heard, it's having a reach nationally, and just last night, Bo and a number of the team were on a panel internationally, looking at collaborations. So the reach is broadening all the time. High quality collaborative health research is fundamental to closing the gap in life expectancy. And today's lineup is impressive. And I'm sure that you'll all enjoy the presentations and find the research interesting and meaningful.